Hello friends, welcome back to my channel. So today we are talking about situational judgment tests for dental code training. As you all know that DCT applications they will be open soon, and for getting admission into DCT you need to sit for SJTs. So through this presentation I'll be talking in general about the situational judgment test and what it is, how is it taken, and few things about it. Okay, let's get started. Situation judgment test. It's a computer based assessment which is given by the candidates who want to appear for a DCT exam. And these they test the non clinical skills which are needed to practice dentistry. It's delivered in partnership with Work Psychology Group and the Pearson View Centers. And all the applicants who applied for DCT in any given recruitment year are required to sit for SJTs. If we talk more about it, then SJT outcome it cannot be carried over to the successive recruitment years. And as already stated that it's delivered on several consecutive days. So what happens is when SJT window is open, you have to book your exam and take an appointment for your nearest Pearson View Center. Okay, you go there, you sit for that exam. Okay, you there it's open for few days so that you can book your appointment to sit for that exam in as per your schedule. All right, and every year if you have to sit for DCT you have to sit for this exam. Okay, if somebody has given the exam in DCT 1, then you will have to give it for DCT 2 a year as well. Okay, let's now talk about the structure of this SGT exam. So the standard timing, what does this mean? That normally if the timing may be adjusted in special circumstances which you have to inform to the for which you have to take the prior approval, but I'm talking here about the standard timings. So when you go to the Pearson View Center, the total time taken is 145 minutes. Okay, you will be given your computer and where you will be given the tutorial just to familiarize yourself with all the keys, with the keyboard, with your position, just to make you comfortable into that examination conditions, and you be aware of how to navigate through the this computer based test. So that is approximately takes 15 minutes, and then comes as the actual real test for situation judgment test, with which you are given the scenarios and you have to do that test, which will count for your uh, final assessment score. Okay, so that is 115 minutes. Okay, and once this time has passed, you are again given 15 minutes to fill the survey form, which is more or less about the test centers, the facilities there, and how easy it was. So you have to rate them, you have to fill that survey form, and it total makes up to 145 minutes. Okay. So what is assessed in these SGTs? So in these SGTs, you are assessed for, as stated earlier, the non-clinical things related to the dentistry. Okay, which is like coping with the pressure. The time is limited here, so how well do you cope with the pressure? And you'll be tested for the critical thinking, appraisals, and the decision making. You'll be presented with the scenarios in which you have to make the decision. What how will you navigate through if you are into that situation? How will you go through it? So that's the thing. Then patient centered care. How well can you make your treatments, or you provide your care keeping patient in the center? That's the thing. As well as your professionalism. So all these things they are assessed in these SGT scenarios. Let's talk about the type of the questions which come in SGTs. So they may be ranking based or MCQs. These are the two types of questions. MCQs, it's simple, like which you all know that you will be given a scenario in which you will be asked that these are the four options. Which one would you like to do? Go for. So you will be pinpointing yourself to one particular choice. Okay. And another type of question is ranking question. So what is ranking question? It is like you're given a scenario in which you will be given four five options, like all these five things. Out of these five things, in which order will you be doing it? So you have to rank all those choices which are given depending on that scenario. Marking is also different in these ranking questions. Okay, like the first thing which you will do, something which should come at A, like first thing, and at the last thing, they carry the most weightage. So if you do those things right, then you are likely to score more. Okay, so these are the types of questions which come in situational judgment tests. Okay, so just to sum up again, this is situational judgment test. It tests your non clinical aspects of your dentistry, which you will be doing, which is needed by a doctor in the UK, by a dentist in the UK. And the types of questions are ranking and multiple choice questions. It's a computer based test. So, based on this, you are shortlisted and you're called for the interviews, the second step for DCT. Okay? And do you find this daunting? No worries. We can help you. If you need any help in doing your SJTs, or you have any other further questions regarding SJTs or DCT exam, feel free to leave comment in the comment section box and I'll try to get back to you. I hope this is helpful. If you find this video helpful, show me some appreciation. Please subscribe to this channel and click the bell button if you so that you're notified whenever there's any of the new videos they are uploaded. That's all for today. Good luck, guys.